Welcome to San Antonio. All right. Our next presenter is a psychologist who conducts clinical research on treatments for post-traumatic stress disorder, interested in how we relate to our dreams, often working with patients who struggle with nightmares. He is a California native, went to college in Chicago, volunteered in Israel, got a PhD from the University of Wyoming, and then did an internship year in Albuquerque. In 2013, he began a postdoctoral fellowship at the UT Health Science Center right here in San Antonio, and if you live in Monte Vista, you might have seen him and his wife walking their greyhound, Sophia. Please welcome clinical psychologist Jeremy Joseph!
Okay. Before I start, you really can't see anything with the light blinding you. Before I start, I just want to say a couple of thank yous. Okay. All right. That's good. All right. Thanks. So, thank you to the rain for falling and then stopping for the night. Thanks for the grackles up in the trees. I want to thank Vicki and Nicolette, who sent a lot of emails to all the speakers and were really helpful. I want to thank our MCs, Beamer and Cox. I also want to acknowledge the indigenous people of South Texas, the Coahuiltecans, whose traditional lands we are standing on tonight. So, I had fun drawing all of these slides just for PechaKucha, so I hope you enjoy them. If you do like them, then thank my wife, because she's the one who bought me the drawing tablet. Dreams are mental events that take place in our brains starting around 3 years of age. Everyone has about 4 dreams each night, whether you remember them or not. This could just be random noise as the brain goes about doing its job while we sleep, but it's a noise that we each react to in our own unique ways. Dreams happen mostly during REM sleep, REM. Electrical impulses in the brainstem travel to regions that control attention, motivation, visual processing, and memory formation. The base of the brain also sends signals to the spinal cord that cause temporary paralysis. Without those signals, we would sleepwalk when we dream. Dreams often feel like reality when we have them, even when impossible things happen. This is an active area of research, but it looks like dreams help us consolidate memories and process our emotions. It also looks like dreams keep the brain activated so that it will be prepared to process new sensory information when we're awake. Nightmares are simply dreams that turn upsetting. Nightmares aren't different from dreams, they just cause us to feel strong emotions like panic or sadness. This can interrupt the sleep cycle by waking us up suddenly, so nightmares can become a health problem because rest is essential for cell restoration and mental focus. Alright, dreams are nice, but there's more to my story. I specialize in the treatment of PTSD, and nightmares often come up in the work I do at UT Health Science Center. After something painful or disturbing happens, PTSD can develop. Nightmares are a hallmark symptom of PTSD, along with avoidance and hyperarousal. So with PTSD, that fight, flight, freeze response we all have is triggered more easily. It's like a guard dog in the nervous system, designed to protect its owner from harm. After something awful happens, that guard dog learns to react faster. When you have a nightmare, all it knows is that something feels wrong, so it starts to bark until you wake up. It might help to think of PTSD like watching a scary movie. The actors and the special effects on screen aren't dangerous, but because of the images and the sounds and the dark theater, audiences still scream and jump out of their seats. It's because their guard dog is getting sensory information that mimics a real-life threat. Having PTSD feels like you're stuck in a tense thriller instead of the romantic dramedy that life is. Friends might try to convince you that you're safe, but your guard dog is stuck in crisis mode. Since nightmares can feel so real, they trick your guard dog into believing that a trauma from the past just happened again while you were sleeping. We have to get sleep to live. Avoiding dreams by staying up late or drinking alcohol to pass out are not viable options. So how do we treat nightmares? You could try an alpha blocker like prazosin or clonidine, originally developed to treat high blood pressure. They dampen norepinephrine effects, which is like blocking an adrenaline rush. This makes sense because your guard dog won't wake up without the chemical that triggers fight, flight, freeze, but it's not like we have something that can actually erase a specific memory or block out a thought that you want to stop thinking about. There's also the risk of side effects, and nightmares can return as soon as you stop taking either drug. How about talk therapy to work with nightmares? I'm trained in cognitive behavioral therapy, or CBT. CBT uses standardized treatments that work by changing the thoughts and behaviors that cause or maintain distress. We can't control every event that happens to us, so CBT helps people develop healthy habits that can make a lasting difference. The best supported CBT approaches for treating nightmares are imagery rescripting therapy or something called exposure, relaxation, and rescripting therapy. First you write out your nightmare, and then you change the story so it ends well. And reading the safer version to yourself every night can train your mind to have the rewritten, unscary nightmare. Studies have shown this can reduce distress. However, it lumps nightmares into the same category as problematic thoughts, like black and white thinking or jumping to conclusions. I disagree that nightmares are a problem to be changed. Instead, we can change how we relate to our nightmares so that we aren't upset by them. Think of dreams like x-rays. X-rays into our thoughts and feelings. X-ray images look strange if you don't know how to read them, but if you understand them, they offer a lot of important information about what's going on inside you. Our dreams also offer us rich information about what's going on inside ourselves if we know how to look at them. So that brings me to the Gestalt School of Psychology. As I said, my training is mainly in CBT, but I know a bit about Gestalt. One of the main themes is that the brain takes sensory experiences and integrates that information into something greater than the sum of its parts. So looking at these 2D shapes, your mind might construct a 3D image. Gestalt has a therapy approach called the two-chair technique to resolve internal conflict. First you identify what your clashing opinions are, and then you take the perspective of each side by moving actually between the two chairs and allowing these two sides of yourself to talk. By creating communication in yourself, and Tom Cruise, you create resolution and self-awareness. Gestalt frames dreaming as a way for our minds to work through thoughts, memories, and feelings. Every element in a dream is understood to be a stand-in for some part of yourself. Gestalt dream work makes contact with these aspects of ourselves, identifies why they matter, attends to the concern, and then unites any fractured parts of the self. And the process is pretty straightforward. You go through the events of the dream, noticing all the elements and transitions between scenes. Using open-ended questions, you identify the actor and the action in order to clarify what they're there to help you figure out. So even the scary people or monsters will still have something helpful to tell you. By understanding our dreams, we come to a better understanding of how we think about the world around us, what we care about, and how we try to cope with issues in our lives. But this method was originally designed to help people understand themselves. So we need to research how well this approach actually works as a treatment for nightmares. I would love to do a randomized, controlled study looking at this question. I think that the mindfulness community would also embrace this approach. But here's a parting thought. Fighting with our nightmares is a no-win situation. That's just fighting with ourselves. When we open up to our dreams and try to understand them, we open the door to understanding ourselves.
Quick questions while we're talking dreams. Falling and then waking up.
Yeah.
You're gonna die if you don't wake up, right?
You won't die. You won't die.
Okay, that was one dumb question. Does that mean anything that you're falling? More anxiety?
As you fall asleep, you get, like I mentioned, those signals going to the brainstem that relax your muscles, and sometimes your brain detects that you're kind of letting go and relaxing, and you'll jolt because it's kind of like an unnerving feeling. But that's how the falling asleep process works.
Do you ever doodle like while you're with a patient and not really pay attention to what they say? Because you're good. I mean, your wife should buy you more paper. Is that something you've always done?
I did some graphic design for a while before grad school.
Well, let's talk about this, because I think you may have another career path out there. I don't know. A couple of other things. Now, the flying nude selfie and the puppy, are these dreams you had, or?
I wish. I just feel like being here on the Arneson stage is the most San Antonio thing I could ever possibly do in my life, and so I just wanted to cram the slide with every like local reference and thing that cracks me up.
Look, he's naked. No. And what else would people ask you about when they found out that you're either into dreams or a psychologist? What dumb question are you just sick to death of you don't want to be asked ever again?
I guess, I don't know. People are they're pretty nice in general, but I think the classic one is, are you reading my mind? That sort of thing. Right? Like, oh, you're a psychologist, can you tell what I'm thinking? That sort of thing. But I think everyone...
His creepy eyes are right up close, and I think he's reading my mind. Not creepy, just don't touch me. I'm from the Midwest. We don't touch. Right. So anyway, you were saying, they think you can read their
Well, I
mind.
think we're all analyzing each other. We're all trying to get into each other's minds. It's just psychologists are good at it.
Okay, two other things. PTSD.
I already caught you. That's it.
I have that now, but I did a story out at Brooks, or actually it was Lackland, where they were using a therapy where they would take them back into the worst of it, like 3D kind of thing.
Oh, okay, yeah.
And they decided that was a horrible thing to do. Is that, what do you don't do that when you deal with PTSD, right?
Yeah. I don't do that, but there's a lot of research on virtual reality. It can be really effective. You do it like in a structured way, kind of cautiously. You don't just like terrify someone and make it worse. But there are good ways to do it that work. And there's still a lot of research going on. But if you're talking about virtual reality,
Yes.
I mean, right now it's like being in Minecraft. It's like
Yes.
blocky. So I don't know how scary that really.
It's scary. And they give you a gun and they have you go back to your home. That's why it's not
We're still
good.
trying to figure it out.
Yes. And do you, like, if there were people up there who have, say, some issues and might need a psychologist, will you be available later for...
No problem. If anyone's, I don't know if anyone's interested. So I'm at UT Health Science Center. There's ongoing research. There's someone in the audience who recruits participants. Maybe she can take her name and number. That would just ruin her night.
Well, we've done our job here. Thank you very much, Jeremy Joseph. Give him a hand for the naked selfie guy.